Nigel Farage last year called for a public inquiry into vaccine harm, saying that, I want to know why we were lied to. He went on to say that we were told to take the so-called vaccine and you won't catch COVID. Take the vaccine, you won't pass COVID on. And both of these things were totally, completely untrue. That's a quote. Directly. There are also concerns about the views of the incoming health secretary in the US, but also we saw in the celebrity world the Steve Bartlett podcast and some of the information out there where health experts described it as potentially harmful. Now, you've spoken about trusted voices, and how can we ensure that, especially at the local level, that your team can work with local boroughs as well as health leaders to make sure that we're getting those trusted voices, but also in the celebrity world and politicians across all parties can make sure that they're spreading positive information, combating that misinformation?
Yeah, well, thanks for your question. As a rule, I think it's unwise to amplify conspiracy theories and falsehoods, so I'm going to repeat some of the nonsense said by people that you've quoted. We saw some of this during the pandemic. If you did a rectangle, on the one extreme you've got, COVID deniers, conspiracy theorists, anti-vaxxers. On the other extreme, those who get it, and the vast majority of us are in the middle. And what we need to do is to work with people that are trusted by the group in the middle to reassure people about the benefits of vaccinations. We've seen in relation to a number of diseases that would kill tens of thousands of people in our country decades ago, they've almost been expunged because of vaccines. Measles being a good example.